NHS is probably the number one election issue. Politicians will be clearly anxious to show themselves as safe and intelligent stewards of the NHS and in touch with the public mood. But they will also want at the same time administration defining policies that will run ahead of public opinion and that they'll probably want to reveal after the election. And these will set out a vision, usually scant details of how to get there, based on assumptions of how people and organisations behave, their own assumptions rooted more in ideology rather than experience of how to run things, and certainly not running things as complicated as healthcare. There's just a few pointers from me on what the politicians can't easily ignore after the election, even if they can or try to during it. So the first thing is, there is rock-solid public support for a tax-funded NHS, 89% in the last British Social Attitude Survey, across all party affiliations, even UKIP, and across all ages. 70% of the public think that the general standard of NHS care has stayed the same or improved over the last 5 years. They don't think it's in a death spiral. Satisfaction is consistently high. Half the public would be happy to receive NHS-funded care provided outside of the NHS in private providers. That's half of the population, even if this meant their local hospital or clinic was at risk of closure as a result. 51% of the public think that the NHS often wastes money. The more a person uses healthcare, the more they're likely to report that they think the NHS wastes money. And 60% of people say they would not be willing for the government to spend less on other public services to maintain current NHS services. And what the politicians also can't ignore is however quickly they choose to make up the deficit by constraining public spending over the next few years. The NHS is, of course, as you know, facing a huge funding gap. At the Health Foundation, we estimate this to be 65 billion per annum by 2031 if long-run productivity growth remains the same. Most of the solutions will be in the heads of those in frontline care, way out of the reach of politicians and the policies that they like to talk about the most, such as competition and choice. So how will they respond? Can they rise to these new challenges in the NHS, let alone those of coalition policies? Or will it just be business as usual?
It will not be business as usual. I think the truth is, before the last election, that there wasn't a plan, or there wasn't a sense of what the plan was to come after the election. Andrew Lansley hadn't made detailed speeches on what he was going to do to clinical commissioning groups and all the rest of it. But it is different this time. You know, there is a plan, as I'm sure most of us, if not all of us, know here. The NHS England 5-year forward view is out. It is published. It has cross-party support. Now, it happens to be a radical plan. You know, it says that the service should not be hidebound by necessarily its history or the way it's been organised or the kind of people it's employed. It says much more clearly, you know, the goal is better healthcare services for patients, and if that means the existing patterns of services should change, you know, so be it. You know, the plan says let's do that. In particular, although it doesn't spell it out in so many words, it says that if we're going to treat patients quicker, treat them more often in primary care, that means that we won't have this great wave of people going to accident and emergency units, about which we've heard so much. We won't actually have as much hospital care at all. We probably will end up having fewer hospitals in total. We'll have better developed primary care, community care, much more care happening in the home. So the point is, you know, it is not business as usual. We will see this service change enormously, but it is around the theme of better patient care. And, you know, in the backdrop of all of this is the money. Everything that I'm saying, everything that NHS England want to do is designed to deliver better care and to save money at the same time, because providing better quality care, safer care is cheaper because you don't have to treat the same people twice. Diagnosing people, treating them quicker is also cheaper because less people are going to go to hospitals, which are the expensive part of the system.
I'd like to say 3 basic things about the NHS and then tie it all together. They're fairly straightforward. One is that it's unbelievably popular. It's interesting that even UKIP now feel the need to sort of defend the NHS. Most people are overwhelmingly proud of it. I think there's overwhelming consensus that all Britons want to, well, the majority of Britons want to keep it free at the point of service. And like Jennifer said, it's the #1 issue at the election. I think the second thing is that it's currently facing unprecedented challenges in continuing to offer the high level of service. And when you look at that 60% of the public not wanting to sort of cut elsewhere to save the NHS, I think this challenge becomes quite stark. And this trend's only set to get worse in the face of an aging population. And the third thing is that, as we've seen in this Parliament, actually changing anything in the NHS is very difficult. I think whatever you think about the Lansley reforms, I think one of the interesting things is I think the Labour attack that really stuck to it was the Tories promised they wouldn't reorganise the NHS, and that's what they've done. And I think that's interesting in the case of sort of how difficult it is to actually change anything about the NHS. So basically my worry is that you have a sort of negative feedback loop which sort of accumulates. The NHS sort of goes into decline, and the ability to do anything about it continues to become very politically toxic. So basically, in summary, I would just like to say that I hear all this stuff about can't be business as usual, and I would agree with that. The worry is where the political capital to change things comes from.